Welcome to e-luminate, formerly known as Sounding Board. e-luminate is a production of Seroptimist International of Novato. We will be talking to doctors from Marin Community Clinics, the largest provider of comprehensive healthcare services to low-income residents of Marin County, California, one of the most affluent communities in the nation. Our guests are Dr. Connie Cadera, Chief Dental Officer at Marin Community Clinics, and Dr. Miko Lagrimas, Associate Dental Director. Dr. Cadera, the dental program at the clinic focuses on prevention. Can you tell us more about that?
At Marin Community Clinics, we believe that prevention is more important than fixing the teeth. So we start before we're born, when the babies are in the mother's womb. And we treat the women throughout the pregnancy to make sure that they have healthy gums, healthy teeth, because there is a link between having gum disease and having babies with low weight or having babies prematurely. So it's very important for the mothers to understand what the link is and for them to start taking care of those babies. Once the babies are born, we want to see those babies at the moment they have the first tooth. So we open up a dental home for them. They come to us. The family learns about nutrition, about hygiene, and the checkups are done every 6 months. So we recommend, very important, that the children get to be seen every 6 months.
At what age do you start?
So when they have the first tooth, so it could be 4 months, it could be 7 months, but we don't want to wait until they're older than a year. In the past, we used to see children later, but it was too late because when they came to us at 2 or 3, they already had cavities. So we want to prevent decay. We want to prevent disease. And the family plays an important role because without them, the children wouldn't be able to do their own brushing or flossing. So we involve the families all the time.
At what age should kids start brushing?
At the moment they have the first tooth. So this is a very important question because sometimes we think that the baby teeth, we should wait until all of them get out, but no, at the moment they have the first tooth, brushing the gums, brushing the teeth, and the parents doing the job for the babies, for the children. We recommend that they do this until they're about 10 to 11 years old.
That's interesting.
It is very interesting. It's something that we don't know, and we have to communicate this to the patients, to the families, because we as parents tend to say go and brush and we're doing our job, but the children don't have the manual dexterity to go ahead and brush properly. So we help them with the technique.
So these are some of the ways that we can prevent cavities and rotten teeth.
Disease, pain. Sometimes the children can concentrate at school, they get lower grades, absences. So there are a lot of consequences out of having a mouth that is infected. So it's very important for them to come to us early on.
Dr. Miko, what does oral health have to do with general health?
So it's actually, they go hand in hand. The mouth is part of the body. So as dentists, we're really focused on the mouth, the teeth, the gums, the tongue, and things like that. But we do focus on the rest of the body. So at the dental clinic, we do screen for high blood pressure, and then we follow up on any sort of medical conditions that they have. That if for some reason they have diabetes and they haven't seen their physician for a long time, we encourage them to make an appointment with their physician, just because diabetes and, for instance, gum disease, they kind of go hand in hand. If you have poorly controlled diabetic, chances are they have poorly controlled gum disease. So if you improve one or the other one kind of benefits. So if someone improves their diabetes control, then their gum health tends to be a little bit better. So we try to communicate as much as possible with the primary care physician. At MCC, we're really blessed because we get to work in the same building as the physicians. So if we do have any questions, we always consult with their physician. It's very seamless. A lot of times it's done electronically, same day sometimes. So the benefit of that is the patient really just doesn't have to wait another week or so or something like that to hear back from their physician. We can take care of the situation right then and there. Yeah.
I've been told that it's not good for children to drink juice, particularly at night, instead of healthier things. Can you tell me about that?
Sure, yeah. You think juice, especially organic ones, are healthy, but in reality, to make one glass of juice, it actually takes several of that fruit. So for instance, like one glass of orange juice will take multiple oranges squeezed out. And when you're squeezing out the juice, you're actually eliminating a lot of the nutrients such as fiber, potassium, things like that, and you're increasing the amount of sugar. So what we recommend is limiting the frequency of the sugar that you intake throughout the day, keeping it with the meals if you want to have juice. You can also dilute it if you want for your kids, so they're getting something, but not the full amount of the orange juice or apple juice or whatever. Another important thing is to not put it in the baby bottles, because they could be sipping that throughout the day. And so, yeah.
The sugar's constantly on their teeth then.
Exactly. So it's really not about how much sugar you have, it's the frequency. So, because when the body, when you have sugar in your mouth, it ferments and it releases acid. And so acid, constantly throughout the day will break your teeth down, and that's how you develop cavities.
So milk has sugar too.
Exactly. Yeah, so milk is very healthy, breast milk especially, in epidemiological studies, it hasn't been shown to cause cavities, but it's when you use it at night. So we recommend to at least, wipe with a damp cloth. If you can brush, but to wipe with a damp cloth and make sure you're getting, any residual sugar, milk off their teeth. Yeah.
What about fluoride? I know this is controversial, but I think I've seen that it's prevented cavities in my child, and I'd like to know more about that because some people say otherwise.
Sure, yeah. So fluoride, it's very safe. It's used not only in Marin, most parts of Marin, but all over the country, Canada, even in Europe. It's World Health Organization approves of it. It's actually one of the single most cost-effective public health measures to reduce cavities in the population. So I'm a firm believer of it. It would be good to have it in the water everywhere if it were up to me. But people have their opinions, but that's my opinion. Yeah.
And the World Health Organization.
Exactly. Yeah.
Dr. Cadera, overall health, the interdisciplinary approach, can you address that?
Yes. Typically, dentists work in silos, but here at Marin Community Clinic, we have the opportunity to actually relate to other disciplines to help the patients. And right now, we are running a program in which we help patients that have phobias or fears or anything that delays the dental treatment. We are working with a licensed social worker to help the patients so they can have sessions. They could be separated from the dental or in the clinic to deal with those fears or any issues. And sometimes it doesn't have to do with fear. It could be any other issue that we can address at the dental appointment, so we refer those patients there. And that's a way for us to look at the patient as a whole. The whole person care is really important for us to take care of the patients, not just the teeth, but the entire body. And many times the patients open up to us, and we are limited to what we can do, so that's what we do. And this is a good opportunity for the patients to get that help, and maybe from that end, get different type of referrals, or definitely in the community we have a lot of resources, and we don't have those right there in the dental chair, so we want to help the person get healthier. Not only orally, but in several aspects when they come to us. So that's one of the areas. And how Dr. Lagrimas was saying, that we have the physicians next door, and it's really, really convenient for them. For us, we have a pharmacy. So we have a lot of services in which the patient can go there and get really treated well and become healthier.
The whole person.
The whole person, yes.
Do you see adults?
We do, yeah. So we're always trying to expand our services to adults. We're pretty much open 7 days a week, and in 4 days a week, we're actually open up until 9:30 p.m. So we are currently also trying to keep more procedures in-house for patient convenience. You know, we don't have to refer them to a specialist at UCSF or anything like that. So we did hire 2 prosthodontists. These are general dentists with additional training to handle more complicated denture procedures, crown procedures, treatment planning issues. And most recently, we started working with 2 local oral surgeons in the area. And so we're trying to accommodate more adult patients, definitely, in our practice.
Well, thank you very much for talking to us today, and we'll put your websites up so that people can learn more about Marin Community Clinics.
Thank you.
Thank you.
Thank you for watching.